Now I call upon Dr. Rajesh Sinha to deliver his talk on post-surgical dry eye, myth, reality and reasons.
Finish in 5-6 minutes.
We have another session after this, the session 2. It's already 8:45, 40. I request all the speakers, current and those who are about to come, to kindly expedite their talks a little quickly so that we can stick to the schedule. Thank you so much.
Okay. So, I'll be talking about post-surgical dry eye. What are the issues? Normally we do surgeries, like we do cataract surgery, we do refractive surgery, retinal, glaucoma, whatever surgeries we do. What are the issues after successful surgeries? We want a good visual outcome. If we have done a cataract surgery, we want an absolutely well-centered IOL, flat retina, nice bleb. If we have done a TRAB, normal IOP, good LASIK flap with a 6/6 vision after LASIK, and then we are happy. But there are certain scenarios wherein the patient is not happy in spite of all these, and this is basically because the patient is not having comfort. He is having symptoms like irritation, redness, foreign body sensation, and that is basically because of the dry eye that occurs after this. Now, following LASIK, what we do, we create a flap, so we cut the nerves and that reduces sensation, and that's why the stimulus to the brain is reduced and thereby there's less tear secretion. This is the neuronal loop that you normally see, and this is the loop. When we create a flap, it cuts here and then it doesn't send signals, and that's why there is less tear secretion. And this is a survey that was done on dissatisfied patients after LASIK, and they found out that 1 out of 5 patients who are dissatisfied because of LASIK are basically because of dry eye that has happened after that. Following cataract surgery also, earlier we used to struggle to get 6/6 or N6 vision. Now we do give 6/6 N6 vision in most of our patients. However, the patients have come up now after that. When the vision is good, the patient is having other problems, and that is of dry eye, and it is found to be quite commonly seen. There are factors that can cause dryness in cataract patients, because these patients are mostly the age of 55, 60, 65. Some of these are perimenopausal females. Then there is meibomian gland dysfunction more often in these age groups. And some of these have coexisting glaucoma. They are on anti-glaucoma medications. And so all these factors predispose. Then when you create a section, you cut the nerves. Then we want to have a 6/6 vision, so we want to do an LRI. We want to, make relaxing incisions and all these things. By doing all these, we cut nerves, and that is another reason why we can have dry eye following cataract surgery. Glaucoma surgery has also shown in some of the patients they have ocular surface disorder, because we use antimitotic agents. There's a risk of damage to the ocular surface, risk of damage to the limbal stem cells. The bleb, if it's overhanging, that can cause faster breakup. Patient can have symptoms. Then after retinal surgery also, it has been seen, with due respect to all the retinal surgeons, but many times what they do is that they debride the epithelium very vigorously, and it takes a lot of time for the epithelium to come back, and there is breakup of tear film that causes ocular surface disorder. and that results in symptoms. This is one study which was done in Japan, if I remember correctly, wherein they correlated the ocular surface disorder with the phototoxic effect of operating microscope light. So since the retinal surgery takes a lot of time, that is one factor that can cause ocular surface disorder. And this is another study which correlated with the use of silicone oil, wherein the patients who were used silicone, were injected silicone oil, they had more dry eye than those who did not have. And most of these patients, when we do surgery, we prescribe certain medications and they have some toxicity to the surface, the preservatives, the polymer per se can have toxicity, and all these factors lead to dry eye. And if we have ocular surface disorder, then in that case, yes, the first and foremost thing is that preservative-free lubricants we prescribe. After cataract surgery, normally I prescribe it for 3 months, and after LASIK, between 6 months to 1 year. This is a big question, which polymer to use. Dr. Quresh was mentioning about what to use when. To some extent, he has discussed about all these. It is difficult to say, but we have been using CMC for very long because of good mucoadhesive property. However, there are some newer polymers like hyaluronic acid, which has a good comfort, and of course polyethylene glycol with propylene glycol and HP-Guar combination. HP-Guar normally interacts with borate to create a layer on the ocular surface, and that brings about symptomatic relief. However, these lubricants are all palliative. If there is an ocular surface problem, that it has to be treated, and there is subtle inflammation. So for that, topical steroid or cyclosporine is useful. Now, cyclosporine also has a therapeutic effect that it increases the goblet cell density, and thereby it improves the ocular surface if it's used on a long-term basis. So I would like to summarize by saying that dry eye can be seen after ocular surgery, after every ocular surgery like cataract surgery or retinal surgery or glaucoma or refractive. And a long-term dry eye can cause damage to ocular surface, as Dr. Quresh was mentioning that the epithelium gets damaged and of ocular surface, so that causes symptoms. The controllable factor that we have is we can reduce the drug toxicity, we can use preservative-free drugs, and we should treat preoperative dry eye. Preservative-free lubricants are the mainstay of therapy. In majority of these patients, we have some subtle surface inflammation. For that, the role of topical steroids, soft steroids can be used, and cyclosporins are very, very useful in these conditions. And last but not the least, a good counseling of the patient is very essential in order to alleviate symptoms. If the patient is well counseled, the patient does have lesser symptoms and lesser problems than if the patient has not been discussed beforehand. Thank you very much for your patient listening. Once again, my idea was to have your opinion about what you all do, so that we interact and become wiser. So I have just made it in a different format. The first question that I'm putting forward is, how often do you get symptoms related to OSD following surgery? A can be less than 5%, 10 to 20%, 25 to 30%, 50 to 60%. Following cataract surgery, I would say, because in refractive, most of us, we do prescribe in all the cases. Well, 25 to 30% is a reasonably acceptable answer. I would say even slightly more than that in some of the patients we can have. Now, do you prescribe lubricants in all the patients after cataract surgery? Yes is A and B is no. Well, it's a huge number. Nearly 70% of people, they do prescribe lubricants. I think maybe a couple of years before, or 2-3 years before, if the same question was posed, it would have been reverse. But these days, we do encounter so many patients that we prefer giving lubricants immediately post-op, so that the patient doesn't come with these symptoms. Do you prescribe lubricants preoperatively in high-risk patients? A, yes. B, no. Okay. If you have a high-risk patient, definitely you would prefer giving lubricants preoperatively. And the last question that I'm putting forward is, in what percentage you prescribe cyclosporin drops, or the patient does require cyclosporin drops after cataract surgery? A is up to 10%, 10 to 20%, 20 to 30%, more than 50%. It is interesting to see, yes, in many of the patients are, they get relief by preservative-free lubricants, and that's why we may not require cyclosporin in these patients. But some of the patients, they do have inflammation, maybe up to 10%, maybe 10 to 20%, wherein we do require immunomodulator to suppress the inflammation. Thank you very much for your patient listening.
Thank you, Dr. Sinha. Now we will present the mementos to our distinguished panelists. I invite Dr. Divyesh Shah to please come on the stage. Dr. Keshav Haldar, please. Dr. Jayanto Dotto. Thank you, sir. Now we will, without much ado, we'll start the second session, session 2. The first talk in this session is by Dr. Paras Mehta. She will be talking on acute chemical injuries and Steven-Johnson syndrome, management pearls